All right, thank you for joining us here at the Lightning Step Couch. We are coming to you today from the NAATP Conference in Denver, Colorado. I want to thank my guest, Janelle Wesloh. She is returning again. We have interviewed her in the past, and we were excited to have her back on the couch today. She is currently a consultant, but she was previously the VP at Hazelden Betty Ford. Thanks so much for joining us.
Thank you for having me.
Absolutely. Can you tell me a little bit about what you're doing now as a consultant and some of the things that you're helping facilities do and manage?
Yes. So right now, the consulting work I've chosen to do focuses mainly on taking the clinical aspects and melding them with technology. So looking at ways that patients and past patients can stay engaged using both clinical tools and digital tools. And I think the marriage of those two things is what really excites me. So I look for projects that really have those two components because that's really my passion.
That's great to hear. I want to ask you a couple questions. We'll jump right into it. How can practices utilize patient portals and apps and wearables to increase involvement in care between visits?
It's a great question because there's so much time sometimes between visits where things might not go as well as we'd hope they would go. And so, what we need is a variety of different tools, whether they're digital or in person, to keep patients engaged in between and post care. And one tool does not fit all. You have to find what really engages that patient, what gets them excited, what keeps them involved, because if something isn't sticky, if we use the term from the tech world, if something isn't sticky, they won't use it. So how many apps do you have on your phone that you never use? You have to have something that brings them back and that makes them want to come back. And so finding the right tools and connecting them with those tools helps them stay engaged, and then that will help increase their outcomes and make sure they, have everything they need to be successful.
Yeah, absolutely. And I definitely have a number of apps on my phone that I don't know when or why or where I downloaded
Like,
them.
what is
So
this app?
I can relate to that. So, how can telehealth and virtual visits and remote monitoring expand access and engagement with behavioral care?
Well, the thing that's exciting about virtual and these kinds of technologies is it takes geography out of the equation. So somebody who lives in a rural area or even an urban area but has no means of getting to a place that provides care that has, evidence-based good care, this just opens up their options and gives them accessibility to places they would might normally not have. So I think that's really exciting. So somebody who is in a desert for psychiatry, there's no, let's say, adolescent psychiatrists available within hundreds of miles, can get excellent care using virtual visits. So that's why it's so exciting because it just opens that up.
Absolutely. Yeah, it takes away some of the isolationism that you can find in those areas. I definitely understand that. Um, So, how should engagement strategies differ between age groups, like teens versus working adults versus seniors?
Right. So a lot of people assume seniors don't want technology, and that's not necessarily true. My great aunt at 100 was on Facebook. So first of all, take all the assumptions out of the equation. But again, it's about fitting the tool to the person. So we had a person in leaving treatment one time that lived in a very rural area of Nebraska. And their closest AA meeting was a 2-hour drive each way. So we're asking for a 4-hour commitment for every time they were to go to a meeting. And they did commit to go to at least one a week. So that's a 4-hour drive plus an hour meeting, maybe coffee afterwards. That's about a 6-hour commitment just to go to a meeting. So you have to, so to kind of fill in the gaps there, they found a bunch of digital tools that were attractive to that patient. And that helped form a very comprehensive, robust plan that would help support them in their recovery. So the key is to take the person's interests, their abilities, and really match that with a tool. So an adolescent might want a text-based app where someone who's a boomer age maybe doesn't want to text. They like email reminders. Or someone who's, Gen X like me might like something more like a social platform like Facebook.
Yeah.
So really, again, not generalizing, but finding out from them what do they like to do? What interests them? What'll keep them coming back, like I mentioned earlier, and really match it up that way.
That makes sense. With technology, you can still use technology, but you got to meet them where they are, right? Yeah, absolutely.
Exactly.
Um, what peer support and coaching options can be provided digitally outside the clinical setting?
That's a great question because a lot of times there's a lot of really great digital solutions. And I think that those are amazing. But when you can couple those with peer support, having somebody who might be just kind of monitoring, let's say, a discussion group, and when someone's struggling, maybe to pipe in or to keep a discussion going, to keep people interested and engaged. Or, like I mentioned, if someone's struggling, to kind of ping them on the side and say, hey, let's have a little chat after this is done, and we can talk about these things. And so they can do some early intervention and make sure that they don't spiral into where they might need to go back into treatment. So then they're able to have early intervention and prevention, because the peers were monitoring that conversation. So I think using peers with that lived experience that can really understand where people are at, is a huge plus when you're looking at how can we combine digital with the people interaction, and peers are a perfect intersection between that. Yeah.
Absolutely. I appreciate that. I got one other question for you, and then we'll wrap this up, let you get back to your day out here on the floor. How should digital engagement complement, not replace, vital in-person treatment elements?
That's a great question, because I think a lot of people have a fear or concern that all these digital applications will replace the very important clinical interventions that are key for good outcomes. And I think they complement each other. It's not a one or the other. It's almost like when people have depression, there's medication, but they also need to have therapy. It's not just one or the other. And these things are complementary. So I think when people are looking for digital strategies, they need to look at how they complement the in-person interaction, because it really can't replace it. And even with the virtual sessions, those are face-to-face sessions. And if you are in them long enough, you start to forget that it's screen to screen.
Yeah.
And so making sure there's some kind of human aspect of the digital experience, I think, is where you really get the kind of multiplier effect, and really see good outcomes, and you really see the patient feeling supported with wraparound care.
I think that's so important. I appreciate your time today. Is there anything that I haven't covered that you think our listeners need to know about from where you are in the industry? Anything I haven't covered?
I think you did a great job
All
covering
right. Well,
some really great questions. I
I
really appreciate it.
Yeah, thank you so much. Again, we are with Janelle Wesloh. She is currently a consultant, but was previously the VP at Hazelden Betty Ford. Thanks so much, Janelle. I appreciate your time today.